My name is Tanja Hedberg. I live in Sweden. I've had bronchiectasis since childhood caused by primary ciliary dyskinesia.
My name is Eliza. I'm from Greece. I was diagnosed with bronchiectasis 15 years ago, and my condition got significantly worse in 2020.
I'm Alan, and I live in the northeast of England, and I was diagnosed with bronchiectasis 36 years ago, so I've been living with this for a while. But before the diagnosis, I went through a series of treatments, so I obviously had it for a while, probably starting 10 years previously.
A heavy symptom exacerbation and self-management burden has impacted every stage of my life, from childhood to midlife, and required continuous processes of sacrifice, acceptance, and reorientation.
Right now, I cannot say that I have found a treatment or a way to manage my condition in a way that is at least stable.
I'm glad to say since we've moved on to the second guidelines, things have come a long way for patients, and the consultant's understanding of the values the patients can bring has changed significantly.
From the moment we selected the questions to be answered to the discussions about each question, I felt that I and the other patient representatives were treated equally with the professionals and that they genuinely sought our feedback.
My role was to convey experiences and needs of patients with bronchiectasis. I did so through the PICO questions and the discussions where I was able to participate. One key point was the importance of customization of treatment and management.
The engagement was very positive on every stage in terms of risk scoring. How do you feel about this? All of the importance for all of the outcomes were patient scored. So the risks and threats that went against all of the potential outcomes were voted on by the patients. So they're very patient-centric targets and outcomes that are included in the set of guidelines. So it was great to work with the other patients. So there were 3 of us, and if one couldn't make it, there were 2 of us, which is sufficient for everybody to have their input and to have different types because everybody's at different point in their bronchiectasis journey.
Patients can describe their symptoms and how they affect their lives directly through their own experience. The same is true for the different treatments, some of which are very time-consuming or have important side effects. Patients can provide information about their own condition and its treatment that professionals might overlook.
One important but often disregarded aspect is the recommendation to test for underlying causes. Knowing the underlying cause, when possible, is not only important for clinical purposes, but for patients. This may provide peace of mind, comprehensibility, manageability, and illness perception, as well as enabling more etiology-specific peer support.
It's important at both the personal doctor-to-patient level and the broader scientific level for patients and professionals to work together as a team and for everyone to understand that each side brings unique knowledge to the table.
Approaching patients is multifaceted and influenced by numerous factors. In general, patients value partnership, mutual trust, reduced power imbalance, and respect for reciprocal knowledge and experience.
If I could make a suggestion for future guidelines, it would be to have more patients involved. Even though we were asked for our opinions on everything discussed with the whole group, we weren't involved in the subgroups where every guideline was drafted in more detail.
Even if you only read the recommendation and highlights, it's got lots of good stuff in there. It's the best there is today.
I believe that having such guidelines is important for every health condition. In cases, however, such as bronchiectasis, where there are so many pulmonologists who don't even know the basics of how to help their patients, projects like that become crucial for our health.
So it's a positive message, and the drugs that are coming along today are even better. And I think the prognosis and the treatments for the future, for the next generation of bronchiectasis patients, will make a huge difference to their lifestyle, their life expectancy, and how they can carry on to manage their bronchiectasis.